And now coming to the RMP in electrolyte imbalances. What happens whenever there is an electrolyte imbalances? This has been asked in various MCQs. This is very, very important. Why? Because this electrolyte imbalance is specifically asked in options. Like we have to know all three electrolytes because they are given in options. So first thing is coming to the sodium channels. The sodium channels already we saw it does not contribute much to the RMP. Why is that so? Because the sodium channel always stays in the hydrated form. Like H2O is there, it stays in the hydrated form. So even though if the sodium channels are available and it is open, they will not enter it very easily. We need an impulse or an action potential to open up the sodium channels. So for an RMP, the sodium is not doing much of any help and it will not contribute much of anything. So both hyponatremia, that is natremia means decrease, natremia means sodium, and hypernatremia, both the decrease in sodium or the increases in sodium is not going to produce any change in the RMP. So this is important. Sodium all of us think it is very important for the depolarization, but for an RMP it is not much of a demerit. RMP does not change anything. Then coming to the potassium it creates a hypokalemia can be there, then hyperkalemia can be there. Let's try to understand what happens in hypokalemia and what happens in hyperkalemia. Before that, I want to say one more thing, that is whenever the potential like that is minus 70 goes from minus 70 to minus 90, it is called an increase in RMP. It sounds like a paradox because it is going down from minus 70 to minus 90, but still it is called as the increase in RMP. This is the terminology that is used. My suggestion would be just see the values. The value is increasing, so they are saying there is an increase in RMP. Whenever it comes from minus 70 to minus 40 millivolt, it is a decrease in RMP. So this is the term used. Just see the values and write it down. If it is moving closer to the ISO voltage, it is called decrease in RMP. If it is moving farther away from the ISO voltage, it is called an increase in RMP. So that is the concept. So let's try to understand what happens in hypokalemia. Hypokalemia, the outside potassiums are very less. So what will happen? The inside concentration seems to be more and they will keep on moving out. So what will happen to the inside of the cell? The inside of the cell becomes more negative because outside is less, more and more is moving from the inside, more negative. So from the minus 70 millivolt, what will happen? It will move on to some place around minus 90 millivolt. What is this called as? It is called as increase in RMP. Increase in hypokalemia causes an increase in RMP. Please remember this, hypokalemia causes an increase in RMP. Whereas hyperkalemia, it's pretty simple. We have so much of potassium outside, so the potassium inside does not have to move to the outside. So what will happen? The inside positivity is increasing and it will create a decrease in RMP. The decrease in RMP. So hypokalemia, increase in RMP. Hyperkalemia, there is a decrease in RMP. And there is one more important ion, that is the calcium. This calcium is very, very important because of its clinical significance also. This calcium channel, it does not directly affect the RMP, but it indirectly affects the RMP. How does it do? This calcium we are talking about is in the ECF calcium, not the intracellular calcium. This is the extracellular fluid levels we are going to talk. The term hypocalcemia and hypercalcemia denotes the ECF calcium. I am stressing it again. I'll tell you why, the reason behind it. So for example, this ECF calcium, what it does is it goes and attaches to the ion channel and it stabilizes it. For example, here is a molecule of calcium. What it will do is it will go and attach to the other channels and they will stabilize the channel. If the channel is stabilized, what will happen? The movement of ions through it will not happen. It is stabilized. It is in a very stabilized state. So what will I need more excitability to create a action potential. The reverse happens in case of hypocalcemia. If the calcium is less, what will happen? These channels become more and more destabilized and more open. So the flow of ions will be very, very, very easy. So let's try to understand what happens in hypocalcemia. Hypocalcemia, the membrane is destabilized. So there is an increase in excitability. Like if I give a small potential itself, it can generate a good action potential. So it is easily excitable and creates an increase in action potential generation. And this is the reason why hypocalcemia will cause a tetany. Even a small impulse, hypocalcemic, that is called as hypocalcemic tetany. Even a small impulse will create an action potential to huge numbers. Even a slight stimulus, they will go for a tetany. That is the reason why hypocalcemia is causing tetany. Don't think, because all of us think that high calcium is required for contraction. So obviously hypocalcemia should not do constant contraction. But here we are not talking about the intracellular calcium. Here we are talking about the extracellular calcium. Whenever the extracellular goes in for a depletion, the excitability of the tissue is increasing and it will cause a hypocalcemic tetany. And this hypocalcemic tetany has two classical signs, which is called as carpopedal spasm. Carpopedal spasm. And there is another sign where there is twitching of the facial muscles. Whenever we tap in, there is some twitching of the facial muscles. So there is twitching of the facial muscles, which is called as Chopstick sign. So both of these signs are very important, and both of them happens in due to hypocalcemia because of membrane destabilization. And what happens in hypercalcemia? In hypercalcemia, the membrane becomes more stabilized. Membrane stabilized. If the membrane is stabilized, whatever I am trying to put an impulse, the action potential is not generated. So that is there is a decrease in excitability. So there is a decrease in action potential generation. That is the reason why hypercalcemia decreases the excitability. These are some image based potential questions that can be asked. What is this image and what is the specific sign named as? It is nothing but carpopedal spasm. So this is nothing but the carpopedal spasm. Then what is this? This second sign is the one where you can see that the patient is being twitched and there is some twitching of the face is happening. Here the facial nerve is being stimulated and the patient is having some twitches in the face. This is again due to hypocalcemia. But now what is the sign here? It is called as Chopstick sign. It is called as Chopstick sign. So this is the another important information or the image based question that can be asked with respect to hypocalcemia.